What about factors affecting dosage and action times? The first factor is age. Newborn infants, especially premature, are more susceptible to drugs due to underdevelopment of microsomal enzymes, low plasma proteins and low binding capacity of these plasma proteins, reduced excretory function, immature blood-brain barrier. Also in infants, there is increased water and decreased fat. In infants, dose is calculated according to body weight, Clark's formula, which is adult dose multiplied by weight in kilograms divided. Children require a small dose than adults. However, they may metabolize some drugs more rapid, so they may need high dose of digitalis, which is used in treatment of heart failure. In children, use Young's formula, which is adult dose multiplied by 18 years divided by age plus 12. In elderly, between 60 and 70 years, give 3/4 adult dose. Above 70, give 50% adult dose. Dose is reduced in elderly due to aging of liver microsomal enzymes, underweight, reduced renal function, and in elderly there is increased fat and decreased water. Second factor is body weight and surface area. The bigger the body weight, the larger will be the dose. However, increase in weight due to edema or fats is not considered. Surface area is the most accurate parameter for calculation, especially in infants. So, dose can be calculated according to age. 1 month, give 1/10 of adult dose. 1 year, 25% of adult dose. 3 years, 1/3 adult dose. 7 years, 70% of adult dose. And above 12 years, you give 75% of adult dose. Or use Clark's formula, which is mentioned before, adult dose multiplied body weight in kilograms divided by 70. Surface area is the most accurate. In infants less than 2 years, dose is calculated according to this equation. Adult dose multiplied by infant surface area divided by 1.73. Sex. Females need smaller dose than males. This is due to fat content and effect of sex hormones on activity of microsomal enzymes. Female sex hormones are enzyme inhibitors, while male hormone is enzyme inducer. During menstruation, some drugs should be avoided as salicylates, castor oil. During pregnancy, avoid teratogenic drugs, which produce fetal malformation. Avoid purgatives or cathartics, and avoid forced uterine stimulants. During lactation, avoid chloramphenicol, phenolphthalein. Route of administration. It can affect the dose. When drug is given intravenously, you give a smaller dose than which is given intramuscular or subcutaneous or oral. Route of administration may affect action of drug. For example, magnesium sulfate. It is not absorbed orally. When it's given orally, it is curative. It is used for treatment of constipation. Rectally, it is dehydrating agent in acute increased intracranial pressure or acute increased intraocular pressure. Intravenous, it is anticonvulsants and antagonize calcium. Drug intolerance, which means oversensitivity or what's called the hypersusceptibility. It means exaggerated action to normal dose of a drug. Drug reduce effect more than expected. This may be due to decreased clearance of drug or upregulation of receptors, increased number and sensitivity of receptors. So in drug intolerance, you have to decrease the dose. Tolerance means failure of response to usual dose of drug. We have two types of tolerance. We have congenital tolerance and you have acquired tolerance. Congenital, it may be racial. Black people are resistant to mediatic effect of ephedrine. Species. Rabbits are tolerant to atropine because they have atropinase enzyme and individual variation. Acquired is due to repeated drug administration, for example, morphine, ethyl alcohol, nitrates, ephedrine, amphetamine, etc. Acquired tolerance is reversible. Once the drug is stopped, tolerance will disappear. It may develop to some actions, not to all actions. For example, when using morphine, tolerance occurs to analgesic action and respiratory depressant action, but there is no tolerance to myopia and constipation. Special types of tolerance. Tachyphylaxis is acute acquired tolerance. For example, effect of ephedrine on blood pressure. Cross tolerance, it means tolerance between related drugs. For example, between ethyl alcohol and general anesthesia. Hypersensitivity or allergic reaction. Drug may act as antigen or combine with hapten and become antigen. This will affect the immune system and the body will form antibodies against the strain. Hypersensitivity or allergic reaction does not occur on first exposure. And it is dose independent. Of course, such a drug should not be used again. What about idiosyncrasy? Idiosyncrasy is abnormal reaction to drug due to genetic or enzyme defect. The most important example is hemolysis induced by aspirin or primaquine in patients with glucose 6-phosphate dehydrogenase enzyme deficiency. Of course, it occurs on first exposure, and such a drug should not be used again. Drug dependence. Habituation means emotional or psychological dependence on drug. And when stopped, there is emotional distress. But there is no severe withdrawal. Addiction means psychological and physical dependence on drug, psychic craving for such a drug. And if this drug is stopped suddenly, it will produce severe withdrawal reaction. For example, heroin and morphine. So, when treating addiction, you have to reduce the dose gradually. Pathological state. Some drugs act only in presence of disease. Example, aspirin, paracetamol, lower fever temperature to normal, but they have no effect on normal temperature. Cumulation or accumulation. It occurs when rate of drug administration is more than drug elimination. For example, digitalis and guanifidine. So, such drugs when used, you have to reduce the dose or reduce frequency of administration. Emotional state. Placebo. Placebo are inner dosage form drugs which produce their effect psychologically. They are used for testing of new drugs. Drug combination. Addition or summation. So we have two active drugs, and when used together, the net effect equals their sum. Synergism. Both drugs are active, but the net effect is more than their sum. Potentiation. Drug has no action by itself, but it increases the effect of the other drug. Antagonism. Drugs with opposite action. And you have physiological antagonism. Means two drugs producing opposite action, but they act on different receptors. The most important example is adrenaline and histamine. Histamine reduces bronchospasm and hypotension by acting on histamine receptors. Adrenaline produces bronchodilation and hypertension by acting on alpha and beta receptors. So they act on different receptors and they have antagonistic action. This is called physiological antagonism. Chemical antagonism. For example, excess HCl can be antagonized by sodium bicarbonate. Pharmacological antagonism, which is mentioned before, either competitive antagonism or non-competitive antagonism. In competitive antagonism, both drugs act on the same receptor, and increased agonist will antagonize completely the action of antagonist. Non-competitive antagonism act on the same receptor, but excess agonist cannot completely antagonize the action of antagonist.